everyone. Welcome back. We are diving into something pretty cool today.
Yeah.
We are talking all about decentralized clinical trials.
DCTs.
DCTs, yeah. If you've been following along with us for a while, you know that DCTs are really revolutionizing the way we do medical research
Absolutely.
and how we bring the clinical trial process closer to the patients.
Yeah, right into their homes.
Yeah, right in their homes.
Love it.
Yeah, I love it too, but there's always
a catch, right?
Yeah, there's always a catch. And the catch with DCTs is that they demand a whole new approach to budgeting.
They really do.
And that's what we're going to be talking about today.
Yeah. And thankfully, we have an awesome guide for this deep dive.
Oh, yeah.
It's an article by the Global Costing Task Force.
Okay.
And they don't just kind of touch on the topic.
Yeah.
They go deep into this framework that they developed,
Sure.
specifically for flexible budgeting in DCTs.
Okay, so flexible budgeting.
Yeah.
That's a term that we hear a lot. But what does it actually look like in the context of running one of these decentralized clinical trials?
Right.
The article uses this really interesting analogy.
Oh, yeah.
They compare flexible budgeting to yoga.
Okay.
I don't know about you, but when I think about yoga,
Yeah.
I don't really think about budgeting.
No, not really. Spreadsheets and numbers.
No.
Yeah.
How does that analogy work? How does yoga relate to a budget?
I love it. It's all about adaptability.
Okay.
Think about what it takes to do yoga, right?
Okay.
You're flowing between poses.
Yeah.
You're responding to what your body needs at any given time. A decentralized clinical trial demands that same kind of fluidity and that same kind of responsiveness.
Okay.
Because things change.
Yeah.
You know, you think you have a plan and then, bam, something unexpected happens.
Absolutely.
Maybe a new, incredible technology comes out in the middle of the trial.
Oh, wow.
Maybe your participants need way more virtual support
Okay.
than you initially thought.
So it sounds like a rigid budget would be kind of like trying to force yourself into a yoga pose that your body just isn't ready for.
Oof. Yeah, exactly. It would just break.
Yeah.
You can't force it.
Yeah.
You got to be flexible. You got to be adaptable.
Okay.
And a flexible budget, just like a seasoned yogi bends, adapts.
Okay.
So there's a really good example in this article by the Global Costing Task Force.
Okay.
A trial had to switch to a totally new telehealth platform in the middle of the trial
Oh, wow.
because the first one they were using just couldn't handle all the data
Oh, interesting.
coming through.
Yeah.
And that added a lot of unexpected costs to the trial.
Yeah, I imagine.
You know, you got to train everybody on the new platform.
Right.
You got to transfer all that data.
Yeah.
And you got to pay for the new platform itself.
That makes total sense.
Yeah.
Why are DCTs so susceptible to these fluctuations in cost in the first place? Because it seems like traditional trials
Yeah.
have managed with fixed budgets for a really long time.
Yeah. It's a great question.
Yeah.
I think it's because DCTs are just constantly evolving, right?
Okay.
They're embracing new technologies all the time.
Yeah.
And they're also super adaptable to the patient's needs.
Right.
All that means that things are changing all the time, which
Yeah.
means that the costs are changing all the time.
Okay.
So you think about incorporating new tech into the trial, adjusting how much support each patient needs,
Yeah.
managing all this data.
Right.
All those things can really throw off a traditional fixed budget.
Okay, so I totally get why we need flexibility.
Yeah.
But how do we actually put it into practice?
Right.
How do we do flexible budgeting?
This is where the rubber meets the road, right?
Yeah.
The task force says the most important thing is to do regular budget reviews.
Okay.
And I mean regular.
Really?
Yeah, like you're checking your compass all the time
Okay.
to make sure you're still heading in the right direction.
Right.
So you're constantly looking at how you're allocating your resources. You're trying to spot any areas where you might be going over budget
Okay.
or maybe places where you're saving money, and then you adjust as you go.
Okay.
This lets you respond to changes really quickly,
Okay.
and it makes your budget a tool that's helping you,
Yeah.
not something that's holding you back.
So it's like having a roadmap,
Mm-hmm.
but being okay with deviating from it
Yeah,
if the situation calls for it.
exactly. You got to be adaptable.
Yeah.
Like our yogi.
Yeah, our yogi.
That's what helps you navigate all the unexpected twists and turns in a
Right.
decentralized trial.
And not be derailed by
Right.
financial hurdles along the way.
Exactly.
Perfect. So the key takeaway today is that in the world of decentralized clinical trials, a flexible budget isn't just a nice thing to have.
Right.
It's absolutely essential for success.
It is.
You got to be ready to anticipate the unexpected
Mm-hmm.
and adapt just like a seasoned yogi.
Perfectly put.
So I'm going to leave you all with a question.
Okay.
What other areas of life
Yeah.
beyond clinical trials
Yeah.
could benefit from this kind of flexible, yoga-like approach to budgeting.
That's a great question for everyone to think about.
It is. It is.
Yeah.
All right, everyone, until next time.